Welcome to the first episode of AY North America Group webinar. This episode is Health Talk, focused on hypertension and general awareness, and is led by Dr. Pius Afriyie AY73 and Dr. George Amoateng AY441. My name is Kofi Edu AY299, and I'll be the moderator for this webinar. Enjoy.
Today we're going to start with hypertension as the health topic. We will define it and give a little bit background, give you some pathophysiological process, which means the disease process, how the mechanisms that take place to cause the disease, etiology, the causes of it. We will dive into some little bit of statistics, where we are globally in the United States. Management and treatment, the options that are available, prognosis, the expected outcomes if you happen to be a patient that's diagnosed of hypertension, and then some patient education. So definitions and background. We have an organization called the JNC, the National Joint National Committee on Prevention, Detection, and Evaluation and Treatment. So OMONA, they kind of give you the parameters as to what is classified as hypertension, different stages of it. So hypertension is defined as a systolic blood pressure. Usually we'll call a doctor's office up. We use your left hand or right arm, and then we check your blood pressure. We have two numbers. One is on top, one is at the bottom. The bottom one is the diastolic, the top one is the systolic. If your systolic is more than 140 and your diastolic is also more than 90, it is considered hypertension. But we have a normal parameter. So if it's 120 over 80, then it's normal. Anything less than 120 over less than 80 is considered normal. In between that, it will pre-hypertension. That means any number that's like from 120 to 139 to systolic, and then 80 to 89 diastolic, that is considered pre-hypertension. Now it is staged. We have stage 1 hypertension and stage 2 hypertension. Would be blood pressure can be more severe than the other person. You see, stage 1 hypertension is any blood pressure that is 140 to 159 systolic, and then 90 to 99 diastolic. And in stage 2, usually when it's greater than or equal to 160 systolic, and then more than 100 in diastolic. So just so you know, hypertension is the most common medical diagnosis in the United States, and not just here, but around the world. It is a major risk factor for cerebrovascular accident, which we call stroke, myocardial infarction, which we call heart attack, and then also kidney and vessel disease. Now, in the general population, it is believed or assumed that blood pressure control is really suboptimal, meaning that even the people that we have diagnosis of hypertension, their treatment is not optimal. They still run around with blood pressures above the normal levels, what is supposed to be. Now, it's important for you to understand that hypertension is the one most important modifiable risk factor for all of these diseases that I've listed here: coronary artery disease, congestive heart failure, stroke, end-stage renal disease, and peripheral vascular disease. Now, heart disease, because of heart disease, there are many types of heart disease. If you need coronary artery disease, your heart is a pump, right? So it pumps blood throughout the vessels of your body, and it goes into the peripheries, into the organs, for normal function to happen. Now, the heart also feeds itself. It has blood vessels that connects to itself. So it pumps, and then it goes into that same blood vessels to help itself feed off of the blood and oxygen. Now, some of these blood vessels can get harder as you age, or different disease factors that can cause that arteries around your heart to harden. Now, when it does that, it can block. You can have blockages in those arteries that feed the heart itself. So you have coronary artery disease, and that results in heart attacks. And then we also have congestive heart failure. The one where it's when you heart failure. And that's because your heart being a pump is not pumping effectively. You don't have effective pump action. So your heart gets tired in pumping. And when that happens, you have fluid backup, you are not able to breathe, and eventually it gives up on you and you die. And then we have the cerebrovascular accident, which is stroke. Two forms. Either say your blood pressure is so high that it caused an artery in your brain to burst, hemorrhagic, or there's a blockage. And so when there was blood coming to the brain, it stopped. It did not get to the other parts of the organ, and so you have ischemic stroke. And then kidney disease. You flood the system so much with high blood pressure and other issues that your kidney is no longer able to do the proper filtration, and eventually it gives up on you. You are not able to filter your body systems, and you end up on dialysis. And if you're not fortunate to be in a place where you can get dialysis, then you die. You see kidney failure. And then you have peripheral vascular disease, and that's like a disease in your arteries and veins that is not able to pump blood upwards the way it's supposed to. So all of these diseases that I've listed, if you are able to control blood pressure, if your blood pressure could be controlled adequately, you can have optimal blood pressure control, you can reduce the incidence of all these diseases. You may not be able to eradicate it, but the incidence of that will be lessened. So the major public health challenge for people like me, George, and any other healthcare provider is to make sure that we are preventing hypertension by educating, identifying hypertension when people come to see us, and treating it optimally, requiring us to give them whatever information that is available so that they can treat it effectively. Obi Onoma or call Dr. Honoma because of nervousness, and they may have what we call white coat syndrome or white coat hypertension, just because of being in the clinic alone. I say we diagnose diseases, so as soon as they are there, they get a little bit of anxiety, and so you check the blood pressure, it's elevated. That does not mean you have hypertension. It's just a one-off leak again. Sometimes you have to wait in the office for maybe 20 minutes to calm your nerves and then recheck it. Now, for you to have high blood pressure, remember I defined it with some numbers, 120/80 being normal, and you have other stages. Just you checking it one time and having an elevated blood pressure does not mean that you have high blood pressure. Now, according to the JNC, we're an organization, you have to have at least 2 or more readings of elevated systolic and diastolic blood pressure before you could be diagnosed as somebody that has hypertension. Me personally, where I practice, unless it's like a severe blood pressure, I like to see 5 readings, morning and evening, and then we watch the trend to see, say, even when you are most relaxed, your blood pressure is high. In the morning when you wake up, it's high. In the evening when you're all relaxed, your fireplace is on, you're watching Netflix, you check it, it's still high. When I see those readings now and it's consistently elevated, that's the word we have to look, consistently elevated for that few days now, then very likely say you have hypertension going on. Pathophysiology. Now, I'm not going to dive too much into this because it's multifactorial, it's very complex, but it sums up as this. Blood viscosity, cardiac output, blood vessel elasticity, neurostimulation. There are many others that I didn't even list here. But how it all plays out in hypertension is this. So your blood vessels, right? It's a tube. Excuse me. Your blood vessel is a tube. Your heart is pumping blood. If your heart is pumping blood and your blood vessels need to relax and contract, you're supposed to, your blood vessels need to be able to expand and contract relative to how much volume is coming in. If your heart is pumping and your blood vessels is unable to have that elasticity, then you increase the pressure in it. Not as here. Say if more volume is going through the hole and the hole is not adjusting as it should be, the pressure is going to go up. We call it peripheral vascular resistance. There is some kind of resistance to flow because of the inelasticity of the blood vessels. And then we have other factors like adrenergic tone, genetic predisposition, dietary salt intake, many things that cause that blood pressure thing to happen. Now, blood pressure is categorized as two. We have primary and secondary. 90 to 95% of the time, regular people that have blood pressure, it's more of a primary hypertension, or colloquially we call it essential hypertension. 95% of the time it's that. But then there are other cases where you have high blood pressure because you have other issues. It's secondary to something that you have. Or kidney problems like chronic kidney disease, maybe diabetes causing that, polycystic ovarian syndrome, usually women, other tumors. When we talk about blood vessel issues, vasculitis, coarctation of the aorta, different things. But what's important for us to understand here is that drugs, Advil, Aleve, alcohol, even nasal decongestants, all of these, they cause vessels to constrict. And so if you have blood pressure already and you're using these things, there's a likelihood that your blood pressure will not be properly controlled or it will be worsened. Now, blood pressure is hereditary, especially if you have both parents that do have it. If your mother has it, your father has it, very likely say you will also have it. Now we have something called epigenetics. There's the genetic component and there is the epigenetics. Epigenetics is more of how your behavior and your environment add on to the way your DNA interprets or transcribes certain things, to make you susceptible to having certain diseases. Now, these epigenetics, it's a new phenomenon that's, is still under study. These epigenetics, if you're able to change your behavior, change your environment, then more than likely you can be able to reverse course if you're having hypertensive issues. Some epidemiology. In the United States alone, there's about 84 million people as of Census 2020, but I'm sure that you can see the trend. The whole world, almost 1 billion people. So it is the most common medical diagnosis around the world. And if you can watch closely on the graph that I put up, it looks like age. As you age, you're more predisposed to getting hypertension as you age. If you look at the men's column, age 60 and over, they have the highest incidence. It's about 58 to 60%. Same as in women, age 60 and over, more likely to develop hypertension. So the more you age, the more likelihood that you could come up with a hypertensive state. And on this chart too, you see Black and African American column, which is the second one. So in the second column, you can see that 34% of Black people have hypertension compared to the other ethnic groups. Ours is quite high. If you can see, it said the white only 23.8, Black African American is 34. They're all in the 20s. You have plenty of in the 34 column. So being African American or Black descent, it's more of a risk factor for developing hypertension. And it's not so much of race, it's more of the epigenetics that I talked about. It's more of your environment, it's the behavior, other psychosocial issues. There's economic opportunities that are not available. So it makes people choose different lifestyles that suits them because of the inability to access social goods. So all of those things play a role. Hypertension can be managed, it can be treated. Now, the first thing to do is what George will tell you more about. It has to be non-pharmacologic therapy. You have to prevent it. The public health challenge is to prevent. First one, the first mandate is to prevent, identify, and then treat it optimally. So non-pharmacologic therapies mean things that does not involve drugs per se. So your dietary habits, we call something dietary approach to stop hypertension, DASH diet. Eating more fruits and vegetables, low-fat dairy products, dark chocolate, exercises, and limited dietary salt. Now, when you are not able to treat it with non-pharmacological therapies, we use drugs to bring down blood pressure. Oftentimes, people that have high blood pressure will require 2 medications. Now, it depends. If you are in stage 1 hypertension, maybe 1, but it all depends. If that one is not helping, then we go to a secondary drug choice. But most of the drugs are beta blockers, which is a type of drug that kind of allow your heart not to work too hard. Diuretics, which kind of reduces your volume, it makes you urinate more so that your volume of blood or volume of fluid is reduced, and so you don't have increased volume going through arteries that are inelastic and causing pressure to go up. We have calcium channel blockers. These type of medications, they work on the arterial walls to help the arteries from help it dilate, allow more room so that you can have that volume to go through and reduce pressure. Then we have the ACE inhibitors and angiotensin receptor blockers. These are all medications that prevent what we call vasoconstriction, like it's not allowing your body, the vessels to constrict to increase pressure. And then other medications that actually do work on the arterial walls as well, vasodilators, primarily. So if you look at all these, primarily to dilate your vessels so that you don't have increased pressure. So blood pressure increases with age. If you looked at the diagram I showed you, the more you advance in age, the likelihood of you becoming more hypertensive. If your blood pressure goes untreated for a long time, you have an increased risk of mortality, death, and morbidity, increased sickness. But if you are able to control blood pressure, treat it optimally, or prevent it from happening, on average, you can reduce stroke by 35 to 40%. You can reduce heart attack, which is myocardial infarction, if you are able to control blood pressure optimally by at least 20 to 25%. And you can reduce the incidence of heart rate more than 50% if blood pressure is controlled properly. I think that I talked a little bit more about heart failure and how blood pressure causes it. The more intense your heart is working because of long-standing hypertension is forcing blood through, pumping, your heart muscles get tired. It gets atrophied, and so it's not able to eject as much blood out as it should. Akumana breath, pump the blood out to the organs as it should. What happens is that fluid backs up, and it backs up through the lungs, further down into the peripheries. You see your legs begin to swell, you have difficulty breathing, dyspnea, means that your heart is exhausted, and eventually it gives out, and then you may die. I decided to share this picture of a chest x-ray, and you can see here it's a 28-year-old woman, and she has congestive heart failure secondary to chronic hypertension. The heart is very enlarged because he's been working on overtime. I wish I presented you a normal chest x-ray so you can see the difference between the two. But this one means that the heart is really enlarged. It's not able to pump fluid or blood out as it should. And because of that, you will have heart failure. Patient education. So blood pressure is a lifelong battle. It shouldn't be, I mean, if we're able to prevent it, then we don't have to deal with it. If you have pre-hypertension and you don't want to be on medications, you have to commit to a lifelong of lifestyle modification. Limit your salt intake, exercise routinely, medical checkups routinely. But if you are not fortunate and you go through pre-hypertensive state and you get to hypertension, whereby we need to treat you with pharmacological therapies, then you have to be committed on your part as a patient. When you have good patient compliance, usually the outcome is really good. And you being a patient, you have to make sure so you take your medications as prescribed all the time. Once in a while, check your blood pressure to make sure that the medication is working, and talk to your healthcare provider as many times as necessary. Most of this stuff, I believe, will be tackled by George. Try to avoid any illicit drugs and other stimulants. Thank you.
All right, thank you. So I'm about to let me the camera on that. Yeah, sure. And first said that right now, I think say maybe you do know. Obia questions that Mr. Mosto, Mama or Montronto. Na yema Dr. George Atwaso na Hypertension fi beautiful for questions. It's about what's our question. How is the whole question via now? Chocho na we are na. That's me upset. But George, but let me ask you.
Okay, so my name is George Amoateng. I practice medicine, but I'm more into wellness, how like I deal in holistic approach to health. So more like nutritional base and meditation and all those stuff. So that's what I do here. So today I'm very excited. I'm going to talk about this very important topic. I would like everybody here to be open-minded. Sometimes this topic may seem as judgmental, but it's not. If you're open-minded and you are here to learn, you can learn a lot from this. So, like, we all here, we are all investing in our businesses, we're using money for different things. We are all here for the money. But then I would like everybody to make it a point to invest in their health, which is the number one thing. Once you have good health, everything will run smooth for you. So, like the nature of this country makes us to sometimes forget about what we eat. Whatever is convenient, we just put in our mouth. But then, as the saying goes, we are what we eat. Whatever you put in your system makes you. So, I'll first go into some statistics that I came across. So, from 1990 to 2010, there is this group. They came up with they study some risk factors that causes death and disability in America. And y'all can hear?
Well, I'm trying interruption people. I'm so bit me mute. Maybe I noise in the free banana.
So they came up with a study, and they studied 187 countries from 1990 to 2010, and they found out that the number one cause of death in America and even around the world is diet. That's the food we put in our mouth. So, and they also found out that 75% of most diseases are as a result of our lifestyle, which is mostly our diets. So anything that we eat, whatever food that we eat, is responsible for most of the diseases and the afflictions that we go through. So, and these are like another staggering report. They found out that 14% of the US population is diabetic and 38% is pre-diabetic, which is like they are almost there. And from study, like almost 100% of pre-diabetic people go on to get diabetes. So if you are pre-diabetic, it's more or less you have it. And they also found out 70% of the population is obese or overweight. And one thing that is very scary is that they found that 1 in 3 women in America will develop cancer of some form, right? And it even gets worse for men, that 1 in 2 men in America will develop cancer of some form. So at this point, we all know everybody is at risk, right? Like we have about 12 people here, and if 1 in 2, if we don't do anything right, we are at risk of getting some kind of cancer. So, but fortunately, there is something that we can do. So, we don't want to be part of these statistics. So, let's see what we can do to prevent all these kind of diseases and cancers. So, some of the things that we can do, like the first thing is our food is what we put in our body that causes all the diseases. So eating healthy, quitting smoking, exercising, and maintaining optimal body weight can prevent 90% of heart diseases, 80% of stroke, 90% of diabetes. So eating healthy food, exercising, smoking. Not smoking can almost get rid of all these issues that we talk about. So the food that we put in our mouth, and I'm going to talk deeper into this, if we're able to remove all the inappropriate food, right, we will not only prevent these kind of diseases, but we can actually eradicate or reverse them. So medicine is good. Medicine is good, but when it comes to medicine, like the drugs that we take, they are there just to prevent disease progression. They are there to treat the symptoms. But I'm not sure if you have ever seen or heard that somebody took this medicine and then his disease was gone, right? So it's actually the food that we eat that can reverse that can reverse diseases. So let's see how food causes diseases. So I try to make this as simple as possible. So when we eat any kind of food, right? Oxygen, the food gives us energy, and is there, and this energy is created by the oxygen that we get in food, right? And the oxygen creates what we call free radicals. And it's these free radicals that, when in higher amount, causes all these kind of diseases. So in lower amount, it benefits the body, but at higher amount, it causes all kinds of diseases. So now we will go ahead and look at the food the food groups that are causing higher free radicals, and what those food that have antioxidants that also neutralizes the free radicals. So the antidote to the free radicals, we have what we call antioxidants that neutralizes the free radicals that cause diseases. So anytime we eat, the free radicals are produced. We have food group that produces free radicals, and we have groups that produces antioxidants, and they are always in constant battle. So whoever wins, if antioxidant wins, no diseases. If free radical wins, then you get the diseases. So free radicals are high in mostly animal products and fats. So animal products like meat, mostly red meat, poultry, dairy, salt, and trans fat. If your food contains these, you risk of getting all kinds of diseases. You risk of being in 1 in 2 men who get cancer. And conversely, if you eat food that are mostly high in antioxidants, like whole plant foods, which are like fruit, green leafy vegetables, whole grains, spices, legumes, and stuff, you will not be part of these statistics. And it's guaranteed if you're going to eat like whole plant food, mostly green leafy vegetables that are organic as well. So we're going to talk about the American diets. We happen to be here. We are enjoying the opportunities that are in America, but unfortunately it comes with other stuff. So we came to inherit the opportunity, but we inherited their food as well. So the American diet is what we call Standard American Diet, which is SAD. And as the name says, it's really sad indeed, because the Standard American Diet contains 25% of animal food, 63% of processed food, which is full of chemicals, and 12% of fruits and veggies. So I like to use images to tell people about, to teach people. So this is how the image looks like in a typical American household. You go for lunch, you have your fries, pizza, burgers. They will put little cabbage on top or lettuce on top. At least in your mind, you got something green. So these are some potato chips, brownies, and all those stuff. So all these things, when you continue to take them, you are guaranteed to have a form of a big disease like hypertension, stroke, cancers. And also I would like to give you like a visual representation of the things that we drink. Any kind of soft drink or soda is full of chemicals. This more or less like you taking this, you know you are killing yourself, right? It should actually be illegal to take this. If you take a can Coke, that's the amount of sugar you're consuming at the time, and these are the small ones. So the bigger ones, the more the sugar. So this is the kind of stuff that we put in our body. Besides, these things got no nutritional value. It's just plain sugar, like added sugar, which is a killer, right? All these things feed cancer cells. So, and number one thing that we can all do for ourselves is to prevent disease from happening. You shouldn't get it and then try to treat it. So, that's it. That's about that. So, I would like to talk about 10 foods that we must avoid, like if we want to live long, if we want to avoid cancers, strokes, hypertension, all those diseases. We should try to avoid this food. So number one is bacon. When you wake up in the morning, it sounds good having bacon and fried eggs and potato chips and all those things. It sounds good. It sounds like Bisa, but you're actually killing yourself. So according to World Health Organization has actually they put bacon and tobacco in the same category. They are all carcinogenic, right? They cause cancer. So if you say I don't smoke, maybe everyone says I don't smoke, but then you go ahead and eat bacon, you are just as notorious as the guy who smokes. So if you can avoid bacon, not even once in a while, just avoid it, and you're going to live longer. And I put turkey bacon here because some people think, oh, bacon is not good. What about the alternative? Let me take turkey bacon instead. It's not because they go through the same process, right? They go through the same process. So any form of bacon is a killer. Then we can talk about fried foods. Our foods here in America is mostly fried foods, and mostly it's commercial. Like even if you do it in the house, it's still not good. But then if you buy it from outside, these are like kind of food that are fried in like very bad cheap oils, right? Which is high in saturated fats, and they are full of salt, high calories, cholesterol. So any form of fried food can put you in trouble. But luckily for us now, like these days we have air fryer. So if you craving for fried food, you can choose the air fryer and then do it in the house. And the next on the list is potato chips, which is also low in nutrition, and they are also made in cheap fats, and they have high sodium, and all these things combined feed cancer cells. Added sugars. So like I said earlier, added sugars have zero nutritional value, and they are linked to all kinds of diseases, metabolic diseases like diabetes and obesity. Like they are all like factors to all the big diseases out there. So if you can avoid these things, you'll be good to go. Okay, processed oils. So if we can do our best to get rid of all these oils, right? You say vegetable oil, but it's nothing vegetable about this. It's the process that goes through this, right? It got no nutritional value. Like it just kills. Grapeseed oil, they put grapeseed there, like oh, it's fruits and the oil, but the process that it goes through makes it terrible oil to eat. Canola oil, soybean oil, they're all just terrible. So right now, what's good in the market is the olive oil, and sometimes coconut oil is good, even though it's very high in saturated fat, but still it's able to contain the heat, like it's able to withstand the heat. So if you fried it, it's hard for it to oxidize to produce the free radicals. So right now, the best oil that you can eat, mostly olive oil, like the virgin form, right? Okay, and the next on the list is hydrogenated fats. These fats are mostly found in packaged food and fast food products. So any kind of fast food is just not good for you. They are mostly made for profit, so they will give you the cheapest ingredient as possible, the cheapest fat as possible. As long as we make the money, we're good. And the next on the list is refined carbohydrates. which is so now white rice. Instead of white rice, we can do brown rice and the wild rice, like those colored rice, like black rice, wild, those kind of stuff. Pastries, if you can avoid it. Pizza, you know, pizza, like even a slide is not good for you, but I know if you were to eat pizza, at least minimum would be like 3 or 4, right? So if we can avoid all these things, it's gonna help us a lot. So, or when we refine carbohydrates, like we strip off their fiber, so now once it gets into your body, it's just going to, like, there's no nutrients, there's no fiber, it's not going to affect your gut, nothing. It's just, you're just eating it, and it's full of sugar, so it's something that we can avoid. And the next one is sausages, which is, if you eat a lot of sausage, like, you risk getting coronary artery diseases. And these sausages and all those processed foods, they cause inflammation, and inflammation is the leading cause of all diseases. Yeah. And the last one will be like processed meats, which are the hot dogs, deli meats, bologna, beef jerky, pepperoni. They all sounds good, but then World Health Organization has again classified them as group 1 carcinogens. So imagine if we eat all these, like all these foods products, we eat them on daily basis. So you shouldn't be surprised if at this age, if you continue to eat them, don't even pray to God for good health, because you're already causing it yourself. So if we can do our best to avoid this, we will not be part of those statistics. So I found this image, which it kind of depicts our African what goes on in back home. Like, this is how mostly it is. Like, we have good, strong family ties. So if you're at the bottom here, you have very strong relationship, you have good family, you have both parents living home, raising kids, they all contribute to good health. Then you go up, it's full of vegetables and fruits. This is what, like, we get from the farm, we grow it ourselves, we get it. Back in the day, like, you walk to the farm, that's another exercise for you. Then you go to the farm, you get it, and you eat it. All these things, like, were leading to a higher lifespan. If you are in this group, there is nothing like cancer, right? Then as you go up, if you try to avoid red meat and everything, then avoid dairy. If they are part of your life, just make it as little as you can. So let's try our best just to make our food colorful, not processed. Like, our food should be raw food, raw vegetables, fruits. The things that keeps us away from getting cancers, right? Getting all those big diseases. Like, if you have diabetes, right? All the kind of food, the standard American diet is just straight diabetes, just straight hypertension, right? But then if we stick to something like this, right, we'll be guaranteed of not having big diseases, right? Chronic diseases, So, like, right now, I believe everybody here is a little bit over 40, right? So it's not too late for us. Everybody is at risk. Me, myself, I'm trying. So if we all try and then stick to these kind of diets, anytime we meet, we are going to be proud of ourselves. We're not going to have all these kind of diseases. We are not going to, our friends are not going to be in the hospital to do GoFundMe. Our GoFundMe should be focused on our diets. Prevention, they say, is better than cure. So if we can focus on good food, good organic food, right, then we are guaranteed of good life, happiness. So this is an image that shows us like we are what we eat. So imagine the image on the left side, right? Imagine you full of these fries, pepperonis, burgers, and that kind of stuff. You are guaranteed to have heart diseases, hypertension, diabetes, all kinds of diseases. This is straight cancer, like, yeah. But then if you go on the right side, if you eat like this, if you eat more green, these things are what? It detoxifies your body, helps your liver, your kidney, every organ of your body. So please, I'll urge everybody to, it's hard, but we can all try our best. We can, we should all make a conscious effort to eat right, to be like the person on the right side in the image and not the left side, because that's full of diseases, if you eat like this, don't say, I don't smoke, I don't drink, you are killing yourself, right? But then if you go on the right side, all kinds of fruit and vegetables, you are on the right path, and you're guaranteed of good life, high lifespan. So this is an image representation of plant-based whole food that we can eat. Imagine your food, your daily food is made up of this, right? More greens, more green leaf vegetables, right? You wake up in the morning, you eat organic whole grain oats, right? Instead of sugar, you put honey in it, not too much, but at least you know honey has low glycemic index and it has other nutritional value. So if you wake up in the morning, you're gonna eat oats, you're gonna eat some strawberries and other fruits, you are even guaranteed of having a good day. Then lunch, get some vegetables and stuff. Yeah. So examples of the whole plant-based foods, we have green leafy vegetables. Like I keep stressing on the green, like if your kitchen or if your kitchen is full of green stuff, you are assured of great life, like great health. So brown rice, fruits, nuts, peats, sweet potatoes, chia seed, bean legumes, all those things is gonna help you a lot. So the last thing I would like to talk about is you look at this health spectrum, right? If you are in the standard American diets, like you're eating animal food like red meat, sugar, salt, white flour, oils, and those stuff, that's the poor outcome that you're gonna have in the right side. But then if you eat whole grains, fruit, vegetables, spices are full of antioxidants, and herbal teas are also good, seeds and nuts, right? It's gonna keep you in the good health outcomes. So if you're always in the left side, right, and you have any kind of diseases, right, you don't even need medication. Eating eating like plant-based food, green leafy vegetables can actually reverse any kind of diseases if you are in the green. But then if you fall into the red, it might be too late for you. Like poor outcomes, like those in the red, those are there like type 3, type 4, stage 4, stage 4, 3 cancers, right? So you wouldn't want to be here. You wouldn't want to be on the red side. You want to be on the green side. So I'll just urge everybody, just always make conscious effort to watch what you eat. That makes us, let's try to invest in our health by eating green leafy vegetables and plant-based food. Avoid meat as much as we can. Red meat, if we can replace most red meat with fish, that will help us a lot. So this is very important that in future, like I would like to see one of our mates say, hey, the thing that we talk about, I stuck with it and now I'm in a very good health. You're gonna hear people are having cancers, but not you once you stick with these things. So I hope this presentation has helped each and every one of us, and if we have questions, we can put it here. Thank you so much.
All right, thank you, Dr. John. Brothers, do that part. I know one for me, one for catching on side, some more questions there for. You about 4, 5, until the next day. Dr. Zema Monkokra, we have some questions in our mind. To show a question here, the show page on Sat na, yeah, my own casa, as you know, Pius is starting hypertension, and there's a question below and Dr. George, so am I food as medicine? Because there are questions below, you know. Once I hear train, I'm going to be careful. Na go be so up down sana. Yeah, bisa. What we bisa. Sepiki ha. Obisa bi. Victor so bi ho. So abam ti no. E ma sepiki start na e moju amshime de careful. Sepiki ba cho betimi wa ma.
Yo, Madam say, Dr. George and Pius Demisha, Madam Wasapa. Hey, sir, I got to say, from what Dr. George was talking about, now that means our choices are very, very limited. If we're doing also it's maybe because and then as you did, you know, casting in a to give us very good outcome. I mean, but specifically, address it, Yadi as Ghana for more. See a jollof, yeah, one more. Yeah, color will create those things, you know. But then to address it specifically, me who say a bit why and I say why. And to batch of a question.
It's a big. We may just say me I do because that question and comes to be said. They say, Dr. George, you can say that I saw me make it. No, I don't find this one very good. You okay? You have me open cushion free mu. Baby dear, but we try so many good United that might have could be. The question I be yama. Dr. George, Dr. George, boy, Kakana, there. Some Kaka, no car profit the M1, Matis, you McDonald's, I'm quite. But some open document debut on free in Vancouver, for so a hand. It's a hot baby in Jakarta for my. I don't green cramaya, bloom crying. It's which is a green to be just service to qualify by your man.
Yeah, so mostly, you know, like typical African diets is better than the standard American diet, right? And by head, you know, refined carbohydrates, no, right? And you know, we can do it in a moderate amount. Right, we can do it like ebia benkuna obedia, right? We bet me reduce benkuna. Then you give more of the soup you know, because like okra is excellent. Like whatever goes on in your soup, like our soup, BBA soup is excellent, right? Because our soup is full of vegetables, right? Our okra soup, our chiozavi soup, BBA, okay. Just that carbs, and they say you reduce, right? If you reduce the carb, I say, we drink more soup, we do more of the okra soup with the benku, we do more of the peanut butter soup, we drink more of those, we eat more of those. Now, yati, fufu nisoni yati, benku nisoni. Then that one will put us in the right path, right? And it's not like yenya BBA, but it's. I mean, like I said, these things are tough. It's tough. Like most of the time, those who are able to follow those will be asymptomatic, right? Because asymptomatic is like kind of invisible. But then if you've already been diagnosed with diabetes, hypertension, and all those things, unless you be at to hospital, that then you wouldn't like the experience, right? But, now we decided that we'll follow the right way, but now that we are healthy, if we reduce the carbs and then eat more of our food, now we'll still be in the healthy path. I hope some understanding.
Doctor, I think say part I now we are refined carbohydrates here or come once. Yeah, Ben Kuni Kinkin and Nina is classified as refined and now I dream which also maybe
okay, sir. Like once anything in your process here, right? Now you eat nutrient free into like ubedi fufu, right? Let's say, oh, if only you can, right? Like these days we have blenders or processors, food processors. Like with me and go for wow, call market, I go to banchine plantain, right? Then you do it yourself, right? And no, it's better than the powdered one, right? Because now it's the convenience, a queen, because you don't have time to do those things. You rather go for the powdered wine, the white flours and all those things. Those are refined and it just accelerates you where if you are pre-diabetic, it makes you get the diabetes faster, right? And if you're already there, so you're not a low A1C, like something like I did a little research about Gary, right? Say Gary, people are claiming say it's good. So it means to say like I heard about kunkunte, say very good regardless, right? See, like those, so Gary and kunkunte, I know I've learned a little stuff about it then. Almost say very, very good. And for so like I said, if we can go to our old ways and get our fresh plantain and cassava and then make it ourselves, right? Then it's going to help us a lot. So, you can't get near that, I don't know. Hard to stop, but we can make it. We can make up our minds and habits, right? And you differ greens, right? Whatever you do, just fat green, more green, right? The greener the body is, the healthier it is. That's about it.
Doctor, by the way, we back over more as a different ones, and now you move on to Victor. So no insanity. Abenquine. Abenquine, I did be a head. But Abeno, I agree my and a crash of all you know, not a Yamayana, a cholesterol man, and a papa idea.
I controversy control, but regardless, like Abenquine is very good. Like palm oil, people say palm oil is not good, palm oil. But then, if you compare palm oil to the rest of the market now, it's it should be like the best because we suck it like process they go through no. Yeah, refining no. Yeah, suck it or straight from the fruit no abeno. It's free abeno no. It doesn't go through all those chemical processes. Eventually, abenkwa is supposed to be good. It's supposed to be, if you are comparing to all the other kinds of oil except olive oil, then you should be able to eat your abenkwa all the time. Now, with spices, all those spices are very good, antioxidants. Then, yeah, you shouldn't have problem eating abenkwa. Yeah.
That's. But Victor, with me, I'm not gonna obey on you too.
Okay, my question. Sorry, but I'm the first one. Ma busan to address it. Me started, maybe a question that busan may have been talked about, but I think it's good. First question here. I hear people say, oh, white meat is better than red meat. And so you see people eating chicken, turkey. Is it true?
Yeah, sure. Like red meat is very terrible to the body. Like red meat, and like especially like the way they preserve it and everything. Like ukokuhu red meat for market now. In your physical eyes, it looks okay, but it's not. Yeah, the normal cereal stuff I have in the crowd not preserving, but life must go on. You have to normally have a tone. Then red meat is very detrimental to the body. If you can avoid red meat as much as possible, like even white meat is not supposed to be the alternative, but then it's far better than the red meat, and then fish is far better than the white meat. So more seafood is better than red meat, and white meat is better than red meat.
Okay, thank you. I mean, Musa question be follow up. What about shrimps? Because I hear people say shrimps it's high in cholesterol.
Cholesterol, right?
Yeah.
Like shrimps is kind of high in cholesterol, but then if you're eating shrimps, right, and then you are following the plant-based food now, right? What they normally fat, green vegetables, or the fruits now, then you should be good. But then, if you are eating shrimp and combined with the refined carbohydrate and all those things now, then you are not in a good shape. Shrimp is still good, and it's better than the red meat.
Yeah, thank you.
It has cholesterol though.
Yeah, I have a last question. I don't know whether I say it to you or not, Pius. I have a friend. Unfortunately, when you stroke, now he according to him, he saw some signs that when say I am go for a pet checkup call. But he saw some signs via now. I think say if he had been a little bit proactive, maybe he could have been maybe in Kombehun in terms could have been prevented. And this is a guy in the face of Yenina and Ubian say he eats well. So the question here too first. I think say my name is Pius Kanwasema. But I don't drink, but I know some of our mates do drink. So is alcohol good in the context of the acne? And secondly, what are some of the symptoms who have symptoms now he may not pay attention, but what are some of the symptoms that depend on because I have to be careful maybe and begin to check whether I'm becoming diabetic or begin to see okay, we say the way my body it may be a sign of of severe hypertensive and so the person may be getting stroke, because oftentimes no say if you are probably will be on or a borderline or a hypertensive or a borderline, if you are symptoms now, it may put his mind to it and quickly rush to the doctor to see him to see if we are okay with him.
Okay, that's it. Earlier, we have been said about my Pius now. On the cover hypertension and high blood pressure.
Meaning, say, we are man symptoms to move and change.
Oh, that's fine. Okay,
no, fine, yeah, thank you.
That's any question, why?
Yeah, our question here very good. You know, it helps us expand on our explanations. You know, Tina, a very good question. I appreciate it. Alcohol, I don't think that there is any clinician that will advocate for alcohol. In general, I mean, alcohol can compete with a lot of medications if you are on medications. If even if you're not chronic, it has a very bad, deleterious effect on your kidneys and your liver. It's just not good. But ADA, American Dietary Association, they recommend if you're a man, you can have at most two beers. That is your limit, 2 beers. But coming from me, I would tell you to abstain from alcohol. We may all be guilty. I mean, if you want to do something, if you want to drink alcohol, you do it in moderation. And if you want to actually find a specific alcohol to drink, I would say red wine. And red wine has a lot of phytochemicals that are very good as far as being antioxidants, just like Dr. George talked about, which can prevent more free radicals from causing you damage in the body. So red wine, it's ideal, maybe a glass at most. Hypertension is considered a silent killer. Typically, there's no signs to say I have hypertension. You may not know you have hypertension. But in my practice, in my 13-year practice now, some people have come complaining of maybe feeling dizzy, headaches, maybe some chest discomfort. And then in trying to assess that type of symptom, you see they have elevated blood pressure. And that's all that it might be. It's just that blood pressure. So when I say vision and yet clear, one says dimming, it's like tunneling, and now you are seeing spots, floaters and things like that. You need to have it checked. Part of the prevention, I talked about the public health challenge is to prevent, identify, and treat. Part of the prevention is, us going to our clinicians as often as possible. At least once a year, you should see a primary care doctor that will focus on preventive medicine. What when you draw blood, you check your blood pressure, you check your cholesterol, check your hemoglobin A1C. We will see that something is not going right. So BBI are clear, because say you are all clear. Just continue to do what you do, everything in moderation. But if we see your cholesterol levels are going up, cholesterol, you are different kinds. And yes, cholesterol, not cholesterol. You are different kinds. If you have a bad cholesterol, is really, really bad. Now you didn't know. So I will cholesterol in number well over 200, 300. Now you didn't have any idea, and you don't have any symptoms. Exercise. But now cholesterol deep inside your vessels, now cholesterol build it. Into be when you pay okay. Now on and I'm very healthy. Now may I say healthy like without any symptoms. One day. Now plaque now build it in the artery. Now a rupture, now a cause of blockade. Into blood and a bar, into mean rich brain, then the brain dies. within minutes now we'll brain engage maybe not affected drastically. Into prevention, and I feel so no prevention. No, part of it is to see your clinician routinely and eating well. If you are on medications as well, you take your medicines, things like that, and also monitoring for signs such as headaches. Headaches. There are different types of headache. Related to hypertension or blood pressure. Migraine headaches. It has nothing to do with that. In fact, sometimes the causes of headaches, we don't even know why you're having the headaches. But what you want to they told that sorry na be when you switching. Told that no feel dizzy kakra why you're lightheaded. I also why you dehydrated when you no manoma. When you see your basa, those are all little telltale signs that you shouldn't take it lightly. You should see a clinician to have at least a workup. You work up, you check your vital signs, and you draw electrolytes, and cholesterol, your blood count. Just a simple, complete blood count, and your lipids can give us a big picture as to how your health is doing. I hope I answered your questions. And then again, Dr. George is talking about green leafy vegetables. I have seen a few patients more health challenge, and sometimes you run out of ideas as to how to advise them as far as nutrition. I just be plain and simple. If you really want to get well, I think you should try vegetarian diet. Okay, but try it for 6 months to a year, and let's see, if things have changed. And oftentimes it works. I'm not saying everybody should go be a vegetarian. You can do your things in moderation, but vegetarian diet, just to put out the back of your mind, say it's also an option that you can try, and it will really, really help you. So I hope I answered your question.
That's it. No, I think that's it. You answered it, yes. To say the Kwame was a Kwame question, I'm saying, Kwame,
okay. Doc, where are Pius? Funny say, okay, ideally 2 beers. Me say me num red wine. No my I say me home per red wine. But to me, I feel say beer okay, mommy. And me beer man me advance it too. But if in moderation, is it to drink to get tipsy, or just let me take 2 beers every week, or 2 beers every other day? Okay. And a second question was here for George. Red meat, let's say some me call slaughterhouse, me am a queen. My dear Buffy, my baby, oh, with your good grill, so I will be is it still no good?
Okay. Before I answer the question over answer now. Over to me, clear. Maybe I'm about 2 beer. Is it 2 per day, and 2 per week, and 2 per month, and
also the size. Because of 2 beer,
boys, bro.
Yeah, 2 beer. They say the cooling temper. So they are never Friday. We age mass and another. What they are bought chicken wings. This one and this and every game, no.
Okay. President and say Corona. Me beer. Me num, let's say me num Stella, and I say Budweiser. Meet me anum, let's say 2 per day. But on it, me num because me num 2 now. I just feel like it's okay. But is it 2 per day, or every other day, or twice, or 2 per week, or whenever? Because me wine you good. Me num red wine. I don't feel comfortable. Give me a 0 on wine.
And I have it. My mother can't say that on wine.
Yeah, I don't recall it being 2 per week. I think is day, but size na yeah can very important. And yet the long ABC star and 52 and yeah can be no be no worry no. Just a regular I think it's 8 fluid ounce beer bottle now.
Yeah.
That's the max. I mean, don't take my word and go out there and say 2 beer and you don't have a thought. No matter no. But if you want to drink her, that's the max. That little bottles for a man, and I think a woman is 1. I'll have to clarify on that, but I do believe so. It's 2 per day, not per week.
That's it. And Dr. George, really also have them. And I'm part now, you say, touch on red meat as processed. And now we put an attack as a name. Now, what about the apple? I could kind of come on. From the kind of say, my uncle now, Maryland, the children.
Yeah.
Now, I'm a diabetes, very now. But your boy.
Okay. First of all, let me make a little comment on the alcohol, right? It's my little research on me, and I'm going to say, dark beers better than light beers, like the light, like dark ones like Guinness and Red Stripe and that kind of stuff, like Modelo Dark, those kind of stuff. If you want to drink, right, it's not recommended, but if you want to, and you're gonna drink that 8 ounce, that little bottle, like the 6-pack, and be back 1 or 2 then yeah, but if in all if you could drink 40 ounce, it's just like about 4 bottles, so that's about it. Yeah, so red meat, this the thing, it's just not good for the body, right? Just that the one that you go kill by yourself and do it by yourself, it's also way better than the one you get from the supermarket, right? Because supermarket, the chemicals are very harmful to the body, and they keeping it red all the time. You bet me at the home for weeks and months, right? So they buy and say, so that alone, it increase the carcinogenic effect, it's better if freezer, then you eat it in moderation if you cannot avoid it, right? If you cannot avoid it, then it's not like now when I was young, so now, so it's like, you can afford it, but just eat in moderation. Like, if you can, get the one from the slaughterhouse by yourself. Now, yeah. So it's still not good for the body, but then if you eat it in moderation, it's way better, right?
Well, be a young man, sweetie. I mean, we start questions. The question is more better. About who become Pius, because question about what I want to say. Can stress and anxiety affect blood pressure? And I'm still, I can't have hypertension once a bit times. And you can't stress, stressing, any anxiety, yeah, affecting blood pressure. And Dr. George, this is 2 questions. No, I said those come. I said maybe you said those guys need kind of say antioxidant food. Not just say. What about balance? Yeah, balance no matter. Can we only survive on just that antioxidant foods? And now say balance no. And now say I'm on a code. It's about Pius answer is stress, anxiety, for hypertension. Now, Dr. George, this one boy cacao. My last question.
Okay. So when we are talking about primary hypertension, we are talking about chronic hypertension. chronic. Debia blood pressure also chronic hypertension. Now, someone may have anxiety in that particular moment, episodic. Maybe an interview be, and I said they may have anxiety disorder, panic attacks, panic disorder. That very moment, yes, it can induce a hypertensive state, right? You can have hypertension secondary to the anxiety. But that's not chronic hypertension. What we are discussing here is chronic hypertension. And then you're referring to stress. Stress induces something called cortisol in your body. Now, excess of that cortisol, yes, it can cause you to have, problems that eventually will lead to you having hypertension. Remember, I mentioned something called epigenetics, which is more of your behavior, married to your environment that causes a change in how your DNA is transcribed, right? So that type of study, is telling us if your environment now, a stressful environment, your work environment, economic environment, legal environment, all of those things can induce stress in your body, and that can cause you to produce excess cortisol, and eventually you will have hypertensive disease. Yes, stress can induce that, but the can say anxiety. You can have a moment of stress that can bring on anxiety, but that's just one episode. But after the situation is past, you are fine. But what we are discussing here is chronically ill, chronically hypertensive state. But yes, stress can cause you to have that. You have to make sure it's not, and stress. And so I think I've come home with stress and say you are in a stressful mode, but you don't even feel it. That's the way it works. You don't even feel you are under stress. But a person from outside, can know. And sometimes we have to listen to our close friends. We have to listen to our spouses, to cut back on some of the workload that we take upon ourselves. I would say you have to take your time. It's not a rush. And, you try to limit stress on yourself as much as you can, because it has serious, deleterious effects on your health.
Thank you. Pastor George, I do so now. A question we met me at Mama. Let's say, focus on only events will be the only antioxidant food in or surviving money. And then called balancing over the other stuff. The only green, whenever I saw sorry now I make a green fruit to be. Now we have the green vegetables. But you survive, sir. So I'm far by any normal.
Yeah. Oh yeah, sure. Like the discipline is very important. Like like my own uncle, for instance, right? Now me medical school, but if you then know or diabetes, right? The A1, was over 8, right? Or taking metformin, any other medicine. So me buy them medications, and I know so I very disciplined. So my chance go through this diet process. On your medication take it, right? With your medication take it, and for a straight year. He ate only like salad and those obedi idea. Like he avoided all starchy food, all barre, all fufu and all those things. It was all green, salad, meat, and annual checkup, it wasn't easy, but his discipline, he was able to do it. To acquire Anna or drop blood, then it had come to 5.6, right? Now, not just I bet even better than me, right? Now and yeah, no, it's like the cholesterol and all the like across the spectrum, like all the lab numbers, are very good, right? And to catch and doctor said, well, your medication take was like, what does? I mean, how did you do it? Like, so there is evidence, I just say, but like I said, if it's only when maybe as summer to right, and I'll be to me upload that kind of way. But now that we are not there, we don't have all those diseases now. At least let's do the vegetarian diet no more. You may not be able to do straight 100% vegetarian, but just make a conscious effort now. Put in more veggies, more fruits, right? More grains, more whole grains, and those kind of stuff. And then if you want the proof, you can just do your labs. This one, start that kind of route, and then the following year, just check your labs. And it's like you bring out new energy, new everything. Like you be like a new person, right? But then if it's too difficult, just try, right? Just try and do that one more, right? You can eat by random, but first with the 8 now with maybe 3. Maybe a contumely be no tree away more contumely still the falco be right? The more stew benkua more okra stew more now benkunika gravy. Yeah. So I mean, even with straight one, you will 100% survive, and even survive way better than, because said the ABR, it's like whatever you do, the consequences, you face it later. We don't face it now, so we don't know. Yeah. So you can survive 100%.
I don't tell that's it. You go house so pay them the sound so. Why not say machine be okotoye. How the check blood pressure machine. As I said, the other thing is the machine you go fiampa. Now my question is how often you use machine in fan check your blood pressure. If you say every week and yearly. That's all. I know it's probably if we never have this issue.
Obia all battle issues with hypertension in the Jerusalem. At least once a week there also with me check it. Now making sure that your numbers are good. You're operating at less than 140 over less than 80. Preventive medicine. A silphy don't quite. Now, when said that when you be a blood pressure problem, once a month to be, I check it back. Every other month to be, I check it back. Because say, and you're not proud of silphy. I was saying I will call a doctor once a year, right? Indeed, every silphy in the once a month to be over, now I check it back. No, so okay. What do you mean diagnose high blood pressure? Unless we check it back on now so check it back on now so then at that point, I would recommend say we check it for the next 5 days, we check it at least twice a day, morning and evening, to make sure say it's not consistently high. If you want like you were discussing, you were talking about anxiety and stress. We have been full in anger. I'll be bomb maybe what I why do we have to check maybe idea and 139, 141. But on a regular basis, to be our only blood pressure issue. Once a month we want to check it. I will check it now once I was right. Check it serially for at least 5 days and see say it's every day be able to check it's consistently elevated. And at that point, you will have to go into the clinic and show them your numbers. So this is what you have recorded thus far. And if it's true, it would also show at the clinic. Now, one thing I want to tell you is And it depends also on the calf size. Also to large adult calf size. To small one, that's a too tight. It will give you false reading. But when you large adult calf na how kakana na and one kasa amia to say be assess pressure and only more accurate than silver top calf and the calf really, really small. Yeah, near our wrist ones view and also I mean when it's new and battery is working optimally, it can give you an accurate reading too. I may prefer the brachial one, which is the one on the upper arm, and be mindful of the cuff size. Yeah, check it periodically, at least once a month to go on a manual check it. But to check in as if still when you're hypertensive, every other month, and not to kill yourself, but just be mindful of it. Yeah. George, me also let me one question now. I was watching a documentary about fishing in general in the world. So there's a lot of ocean plastics. Plastics are non-biodegradable, but eventually, it disintegrates into microplastics that's consumed by the fish. And I'm na kakra because you and I know that a fish is a very healthy meat source. And maybe one say, Charlie, I don't think so fish is maybe because of microplastics and you're healthy, all right, but given the current global challenges on scarcity of food source and rising population and how we are treating the environment as a whole. I'm not skeptical about that, kakra. So I don't know if you have any research on that, but fish and microplastics, I'm a bit concerned about that.
So I mean, this is the kind of world that we live in right now, but it's in general, right? Fish, wild caught fish, NACD, and these wild caughts are also in this ocean and they are eating the plastic. So I'm not sure, sir. Like, who needs some research be out on how it's affecting these fishes and the impact on our health. So for now, it could be. It may be causing problems. However, we really don't know. And then, but sir, by nature, and scientifically, like, if these things will cause problems, I say like, continual exposures are right. I'm not sure if that fish have that kind of lifespan that with me I expose it to these things to the point about being problems or carcinogenic I think we should just it's still going to be better than the red meat.
Of course.
So we can if we put that factor in there, then we between into moderation, like just eat your plant-based foods and you'll be 100% all right.
That's it.
No question, quick one, bro.
But when any Pijansa, Obi Kasa, better than we have used to have no Pijansa. Yamaba from Madi film. That of you who say, to the whole answer, now you are two.
Okay.
Vital with a fatchame. Vital, what the traffic to over to answer a question. My ways so ya DBA in affecting and say age. Ya can't track and ya pay a kind of free Timon no one. Question is say, how does age affect blood pressure? So, what can it be done to manage hypertension in older adults if the age affects the blood pressure? But we are not Mama me have it also the need.
Okay. Very, very good question. Remember in my slides, I talked about vessel elasticity. when we are younger, we have abundance of collagen, right? And collagen plays a big role in on the blood vessels, how the blood vessels is able to adapt to blood volume, expand and contract. As you age, you lose collagen. You replace collagen with keratin, so your blood vessel elasticity also decreases. You can't stop that. Maybe you can have gene editing to do that, I don't know, but that's just a natural phenomenon. You lose collagen, and so you have some kind of stiffness. That's given. But then in regards to food, would the bad unhealthy foods and oils and so it also leads to atherosclerosis, which is hardening of the arteries as well, and that can cause you to have elevated blood pressure. And it all circles back to eating healthy foods and making sure that your arteries are not hardening. There are some factors that you can change, but if you eat a healthy diet, you can extend you can improve your life expectancy. I hope I answered your question.
But I'm not answer. What do you? Oh yeah, one answer.
Good.
One answer me, that's about your Victor, man. For
Yeah, na me busa say, almost say fruits here good, So are all fruits good?
Okay, yeah, fruits are very good. Just that it also has sugar, right? But then that sugar is different from added sugar. Like, so okokoto fruit juice is here now. There is nothing good about it because the sugar na afra. But then the sugar that comes from the natural sugar in fruits, it still has negative impact on the body. But then if you're focusing on the fruits and the vegetables, and we have fruits now because it be acidic, it be alkaline, so that one you can go on it. So it's uchusu, the alkalinizing fruits now is better than the acidic fruits, right? But in general, if you don't have diabetes and you are eating fruits and vegetables, you are perfect. But then if you have diabetes, that's where you have to watch the kind of food that you eat. That one is more advisable to eat more vegetables than fruit. But if you're a regular person, you taking the annual checkups is very important because every kind of disease is reversible, right? We are not check up and who said baby go on, right? Depending on which stage now, we will say you can eat all kinds of fruits, and I said be selective. A bit the BH be a good, it be better than the other, but if you don't have any, if you're not sick yet, they are all good. But then if you have diabetes and other stuff, then you do the research and take the alkalinizing ones.
Thank you, doctor. That's it. Hey, it sounds like a question. Yeah, Rasmus now. Also, I'm find a question back from my. Rasmus, what do you mean?
All right, Kofi made I say maybe only a quick question to Dr. George. On my wife Nasumi Miss Akra. Ote here, meaning the tea there no I don't eat a lot of breakfast. My breakfast is mainly egg and coffee. And the 20-ounce cup back or now maybe eggs too, mostly Mondays through Fridays, or as much as I can. Now me person me who say and no because I know say there's been a lot of conflicting researches on especially eggs. It be saying me person me who say if it's a combination, especially eggs and then also coffee, then how much is too much and how much is good enough.
Okay, so eggs, and also like AB did the BH, right? It's true say conflicting reports on them, but from my research, eggs are very good. But then if you are eating eggs with all those banku and fufu and all those any American diets, burgers and stuff in there, then you'll be worse off. But if you are eating eggs with the veggies and stuff, then you'll be better off, right? Like I said, my uncle made they need to what we call ketogenic diets, which you can eat a lot of eggs with a lot of veggies, no carbs at all, right? But if you combine eggs with the carbs and the standard American diets, then they're very terrible. So from my research, almost say the cholesterol in egg has a lot of cholesterol, but the cholesterol in egg, that's organic eggs. And I said pasteurized organic eggs, not just any egg, right? Not the cheap eggs. If you go to Whole Foods and buy expensive eggs, like the organic eggs, now if you eat 2 a day, it's good only when you are eating with a lot of vegetables, but then it's very bad when you are going to add it to the junk foods, right? Yeah, and then coffee is are the same conflicting reports, but then research actually says coffee has a lot of good things. So as long as you don't overdo it and you get a cup or 2 a day, it's actually better than, from what I know, it's better than the one who doesn't take coffee at all. Yeah.
That's good. Then my uncle na question me go 1,000. I so kata enti
better say coffee. Dr. For the Masidio. George, where do you have a question? My question is who can sweet potato say come on? Me person will change why sweet potato and not any ordinary potato? Sweetness not how does it make any difference?
It comes to those starchy things now, and I said when it comes to vegetables in general, the colored ones, or more some components be a benefit to body, So from research, almost say the light one, the white ones, more starchy, and then but the sweet potato in general, like of all the potatoes, sweet one in general, Omar research said they have other components that benefit the body, So if only you choose potatoes, then it has to be sweet potato. Yeah, it says sweet, but it doesn't mean it has a lot of sugar, but it's actually very beneficial to the body.
That's it. Hi, sir. Your answer is okay. Mr. Amo, you say the according to the say sounds like a time yesterday. The air it is all question be a number of see na enche be ni arapia. Me amu de Mr. Media. Mr. Owo Mr. Question na no appeja za me hu na ya hu ni pakro bi say.
More question. Sir.
Moses ni. Now they should have flag on Sabbath for you who say. And now who you the area Bekasa.
Yeah. If I try fasting and so a boy in these states.
No, I see a good question. But Dr. Amoateng or Dr. Joe.
Yeah, like fasting, scientifically, my proof say fasting is very good, like because your gut, is constantly working. So when there is that fasting or like intermittent fasting, it helps the body a lot, right? Emma body need to take time to heal itself than constantly exposing your body to food. The fasting is very important, like not fasting as in we have like good fast and bad fast. So if you have the knowledge on it that you're fasting and you will not be taking medication, and like if you know that kind of stuff, and I said, yeah, right, like then. Yeah, so if you can research on intermittent fasting, that one has been scientifically proved very good for the body. Okay. Fasting is good.
That's it. So a question be up so the firm Mama Nembra na ebi ni vam de ba kwaso so na any appeal. Question you have Mama Nembra. Ebi ni wa let me ba kwa me do be afem na kwa say twa me be up. Idea. Ebi my idea but it sounds like I'm relaxing too much. Just a mark can hold. And this whole TV media not to say question I'm working can say hypertension. What other kind of say body parts need to be affected? You say it will affect 20. And I say kidney and now bisa. But to me actually more my boy. And I mean other questions so I'm more no so I can only say hypertension quite I be a it cure. And a lifelong condition be na why?
Yeah, hypertension situation be to me also stroke. So blood pressure near wall uncontrolled for a long time. It can lead to a burst in your arteries in your brain. But yes, when you're hemorrhagic stroke. And I say of relating to diet and also say diet and also now build plaques in your arteries and so. Chronically hypertensive means you are chronically inflaming your inside walls of your arteries. Plaques in the build eventually plaques can rupture and then they can obstruct the blood flow. If it's to your brain, you get a stroke. If it's around your heart and so the vessels of your heart and so you get heart attack. It can even cause problems to your kidneys such that it can cause your kidney to decrease its filtration function. Into kidney filtration, cough and also with different stages. Cough because of hypertensive disease. Well, those things, it's a cause and it's also a outcome of kidney problems. It's like they're both interconnected. Sometimes or a kidney problem, ends up causing him to have hypertensive state because remember, kidney also regulates blood pressure. Blood pressure in the kidney, over too much of blood pressure, it can affect your kidney and your kidney can shut down. And if it shuts down, you're going to need dialysis or sometimes a renal transplant. Your eyes, yes, there's some kind of stroke. Yeah, it can cause you to lose your sight. When you're blockade in your retinal arteries now, you have an eye stroke. And I say the chronically hypertensive state also can cause you to have inflammation of your retina. Eventually it will reduce your vision. But if you're not fortunate enough to when you stroke around not just your part of the brain that controls the eye, but in the vessels of the eye, also you can suffer visual loss. I hope so I answered that part. Mm-hmm. And as far as say, can you cure it? Some people have been able to reverse their hypertensive state because they changed their lifestyle, they changed their behavior. But other people also know their state is chronic, and their best bet is to stay committed to the medications that are offered them. So when you're younger, you may have room to reverse course. Or limit your salt intake. And causes you to have fluid retention. When you have fluid retention, you increase your whole volume. That also increases pressure. You have to cut back on your salt, how much salt that you consume. But if you have all these dietary modifications and lifestyle changes, and that's it helps you out. You may not need to be on blood pressure medications, and in the interim now, you may actually not be hypertensive at all because you've changed the epigenetics, you've changed the environment, you've changed your behavior, right? But to be honest, when you're fortunate, you have to stay on the medicine for as long as you have hypertension. So there are two things: either you benefit from prevention and lifestyle modification, or you benefit from pharmacological treatment with medications.
But as a doctor, I said it was kind of sounds like I'm a mother, but I did about poetry, and I treat my juice to see any salt. Salt, would the probably be a pack come up. And as I say, my young said, salt is salt, the anti-free. Not as a micro, the good crowd of Mr. Yeah, is there a salt replacement? But you're back on one. Let me replace salt with BB as done. I've been as salt this now. I must be my damn way, but you will be safer.
Yeah, you can't say many inch. You can't say many inch. I know you have to understand that there are certain conditions that will restrict you from salt completely, salt restriction. Athenochrony may be temporary. But we are not saying don't eat salt. We are saying limit the dietary intake. Obi ohonoma wodin chinema wo gene bia na wadi awie se wo susu bia wo to aso ahwe a wo ntimi wodin chine to the nonsense degree. But enchine a very important electrolyte is sodium, a critical electrolyte in the body, and you need it. So with sodium equal that low krana, why we are between a seizure. So we are not telling you not to eat salt, but just like we've been stressing from the beginning and George has been saying, it's all moderation. You can eat salt, but make sure you don't overeat it. People suggest well, you can cut the salt and replace it with pepper and other spices. You may still have some sodium in there, but my recommendation to you is don't abandon salt. Don't say I'm not going to eat salt at all. Put something. It's the key word here is moderating the quantity that you consume per day. Of all foods, there are limitations as to how much you can eat in a day. You just don't have to overdo it. And if you stick within those parameters and those limitations now, with exercise, eating your fruits and vegetables, routine health screenings and healthcare visits, and having a good social environment, I think you have a good chance of increasing your life expectancy.
Thank you, Doctor. Doctor, I'm going to say I'm going to be the switch. Is there a replacement? You'll be before having it in your cassette. The very replacing China. Remember the Kakrama Miyama, and it's been the same crop here. At the sugar. Is there sugar replacement or you will be better for China?
No.
Okay. I'm going to say I will refer that to George, but
what you can do is say open source and Chinsupana is mostly like canned products, or those snacks near that those ones will contain a lot of salt, right? So if you can limit eating those canned foods and limit outside eating per se now, once you cook in your own house, you know how much you're putting in. So oh, did you feel now you can save yourself a lot, and ever how you can meet your daily intake in portion than eating outside and all those food and air preserving it contains a lot of sodium. If you avoid those things, the eat the feeling should be good enough for you to avoid problems.
Doctor, that's it. Now, actually, need to say salt. Yes, would be a near salt to gum and no healthy. And so when we will be an answer and be a compatron and okay. If I should go have a bonfire, one fast salt to Munkes, or the young one fast salt to na the year on fast salt to what on one mood to be a sort in down, not a claim good, none of them. And no, I better think it's still just where a rule. Near the salt in the Guma, and I say I know we now for Seguma. Which one is healthier?
That one, yeah, it shouldn't need any scientific idea for that. But it's just like when you're cooking, all the spice eguguma, it's better you put them in a blend, cover down, say, be enough, or the while you're eating alcohol, not make video eguguma at that. It's better you cook with it. If anything, if there is any assumption, probably like the heat will, can get rid of some germs and stuff. But I don't think that we'll put in. Maybe when you're not the biguma, no, probably you're gonna add more than you needed. So, but as to whether we digum before or after, no, I don't think it makes any difference. But the limitation only make a difference. Just as long as everyone tastes like a craving, you don't need to keep adding. Like Pius said, somebody will before so taste the crown or the gumansa, because in his mind, no matter what, the salt is not enough, not even. It's the limitation that matters, not before or after.
Okay, don't worry that. I thought we a question or which me be saying time and be doing the any wrap up. I mean, so Odi was I may try some for the question about the question if the market. Mr. Who will be now up to Jans and Waka. Obi that's all. I don't introduce. Was it Moses?
One quick question. Maybe any hypertensive medicines and matters and as well to me also kidney problems after prolonged usage. So dog with me up wire on
that. Classifications in the categories of medication. We'll say IBIA or the part of the body that it works. Some medications work directly in your kidneys to kind of get rid of excess fluid. It can also work in your vessels directly to try to open it. It can also work on your heart itself to slow down the effort that your heart is pushing the blood out. Sometimes one medication may not be good for you, the person. There is this medication here called Norvasc, a calcium channel blocker. It helps dilate your blood vessels and all that in your extremity. But some people put swelling. Every medication has side effects. Even Tylenol. Some people are allergic to Tylenol. And prolonged use of anything can cause some sort of organ dysfunction. But fortunately or unfortunately, when we do something called risk-benefit analysis, where we think about the benefit of being on medication versus you having to go through hypertension and getting an end organ damage, like getting stroke or heart attack or kidney failures, things like that. But there are many different kinds. Intise bako enjoa, ibia this other kind will work for you. But medication bi obi do ba to subiano. You should do your due diligence. If you don't know yourself, ask about the potential side effects. Some can be life-threatening. Yes, it will be to say ACE inhibitors or far to me mouth swelling, your throat swelling. Some could cause anaphylaxis because of certain certain chemicals that are in that your body may reject. But no medication does not have is free of side effects. Every medicine will have some sort of side effect, but there's a curve. Majority of people may not experience that type of side effect, but there are few people, outliers, that will experience that side effect. But yes, maybe I would to say it might affect you adversely versus somebody else. So it's not just blood pressure medication that have an effect on the kidneys. Yes, they do work in the kidneys, but to what extent is it benefiting you versus to what extent is it going to hurt you? Which one do we care most? Your health, not getting heart disease, or maybe a little side effect of the medicine? In this case, it will be your health. And if it's not appropriate, we will choose another medicine that will work elsewhere that will help you.
That's the doctor. Really, Moses, answer. What I try to back from now, any European. I show be a night to try and one now the Abani. It's me, I move beyond now. So, doctor, really, a question I want to say. Diet or dietary supplements. Adibia, Sebi, you move before popular. Won't be check out diet in some year. Then the what to send reading the supplements, even now they fire the or half. My question is in average, and I say, are there any potential risks associated with these dietary supplements? But Dr. George, we answer no, Dr. Pius Afriyie.
Yeah. So when it comes to supplement, like you see, the best supplement is your food. Like if you are eating all these plant-based foods and vegetarian diets, greens, like you don't need all these things, right? Unlike it, pills are they always have side effects, and it's a business, it's built on profit. So omo make it pills, if they make it so omo tried it, the best ingredients begum, let's say $200 obi on top, right? They will make it as cheap as possible. Omo church say it has this, has that, but be require placebo it's better you just take charge of your health through nutrition, like just eat it. Like there are some things here, like if you take the greens vegetable, right, when you chew them, right, as compared to juicing, when you chew there are some bacteria be in your mouth, right? Hormonal, they help. I'm not bacteria, enzyme, right? It produces nitric oxide, which will work on the vessels, not dilate vessels, right? Would dear general chew, a general more nitric oxide, not enzymes in this work home, not I enhance done. So, could take a supplement, you don't know how they made it, there is no check and balances, it's business, so it's for profits, it's not for your health. We don't make supplement for you to live long. We make supplement to make money. Whether it's going to help you or not, we don't care. It's better you eat right and stop the supplement. But then, if you think, hey, so we eat right in there, there's no way I can, then fine, you get a supplement. Then you just hope it works. But it's not. The best shot is the food.
Vitamin C, BCS, say that. Come in alpha. The vitamin C from a bamboo. That vitamin C to count.
Some vitamins, like if you're eating.
I know. 1,000 mg. I'm just a popular part. We are so here with smoothie quite with 1,000. We go next.
1,000 there, bro. You can just write anything.
It's
if you are eating right, then you don't have problems with this supplement. But then they say you get what you pay for. So from experience, if you are buying, you have to buy the best in the market. Like the expensive ones, at least they know that they spend money on their research, how to make it and stuff, the absorption rate and stuff, and they are not going to lie to you, then you pay for it. But the cheap ones in the markets, that one on there, we can say is 100 whatever, 1,000 whatever, but it's not really. But one research I've known about this vitamin D, I've researched on it, is a very good thing. It helps with a lot of stuff. So yeah, but then it has to be the right vitamin D. From which store did you buy it? Right? Anybody can make it. The regulations really doesn't work even in America. So it's better you eat the right fruits and vegetables and plant-based food, and you'll be okay.
That's the doctor. I think a question we have me train so good say be but we on my the answer for we. I was about to say a question there next to the question and we link and say coffee make kushari. Me ask me need me join am say need the na me link. Na the question na say ever kushia no ka say we any ba ma titi say kushia the nka be ya na be too kra na tria. E so you could film na yolk back because you're only allowed to consume, and now it's healthy to consume only one yolk. So yolk as me abatiti. And patch the crown because I say if you say me we could share my 6. We yolk in every and a car white. And because I'm saying healthy and no crown much so for electric weight now back. Now the sound fight and they will know yolk if we healthy next time more but come. I should teach you to
okay, like Omo, your conflicting reports, right? But at the same time, like I said, and too much of everything too is bad. So Ukokori yolk 6 at the time. Yeah, but from my research, right? If you are eating good eggs, like eggs, the expensive eggs, no, right? Not the Aldi and Walmart eggs, but the organic pasteurized eggs, right? If you are eating those, like that yolk is actually good for the body. If you are eating the right diet, right? It has like these powerful things. I mean, it's yolks that makes the chicken, right? So that means it has powerful things, right? But only when you are following a strict diet, when you are following like paleo diet, that kind of ketogenic diet, those kind of stuff, no. That means you're avoiding all junk foods. But if you're eating egg, the yolk with junk food or with the standard American diet or with the starchy foods, then that one you're killing yourself. But then if you are following a strict diet, when you're eating yolks on a good with the green vegetables now, then you are doing yourself a good service. But then once you combine with all those things now, so you can't eat too much of it, but then it's actually good when you're eating healthy. Then you can incorporate eggs with it.
Thank you. Doctor, I really want some question if I'm from square. But as the picky one, also didn't hear from my fee. The big bro.
I can say last September you share there was one trend I saw among all of us. I don't know whether it's a part of opinion and I say maybe God is blessing us. Yeah, and a very biscuit fruit, and all of us it looks like we are all getting it. And I think it is a worrying trend considering what we are talking about. Can they speak a little bit about it? Sikafruno, is it because of what is causing it? Is it the diet in the year and also lack of exercise and what are the health implications? And as I say, money yesterday, but if it is normal, I don't know. Until if they could help us with, I know. Boy, the most
picky. What kind of situation? Skya, I did a fire bomb caddy. Then I'm getting that entry. Not about anything.
Strictly a very like it's just a sign of bad health, right? Sikafro is like it's a sign of it's a bad omen, like it's bad of everything.
Yo.
And it's also it's so hard to get rid of it. Like Basana or intestines they go here, I mean, like all the good bacteria, good bacteria and bad bacteria na fight over them, right? But all the good ones, we are killing them. Now intestines, as swell it, right? Ofu air double as obia yeah. It means your intestines to your liver and all those things, they are all diseased, double size, right? There is nothing like if there's a bad thing, Sika can buy it, then it's Sika fruit because it's just a killer, But once you change your diet, if you go Sika fruit, the best thing is to change your diet, and it will vanish as as quickly as it could. Sika fruit is bad.
But I if I crown and can't George deal Sikafruno. You're found a truncal obesity. Like George is saying, it's a sign of bad health, a part of metabolic syndrome. Metabolic, it has to be a syndrome. It's a constellation of diseases. Into obia or Sikafruno, and the abdominal measurement and much more than it needs to be. That person is likely to probably have high blood pressure, have high cholesterol, and probably not controlling their blood glucose that well. So when you combine Sikafruno, which is the truncal obesity, with blood pressure and high cholesterol, you have an increased chance of you suffering heart attack in your lifetime. So Sikafra is a bad sign. You have to try to reverse that trend, by modifying your diet, so that it can be reduced. When that is reduced, it also means the cholesterol that is circulating in your blood walls, it's also going down. At the same time, that same strategy that you use to reduce the truncal obesity and the cholesterol in your arterial walls, that can also reduce blood pressure. And so you begin to phase away from metabolic syndrome. But you having that big pouch, it's a sign that metabolically something is off and you need to take care of it.
Yeah. So, like I can give you a homework, just go out there and then see if you can ever see a fat old person, a fat old man or a fat old lady. If you can ever see one, if you see 10 old people, about 9 of them will be slim. So that's a sign that if you're fat, you are dying.
Okay. Doctor. Sounds like I don't know, maybe a dream day. Mama, I may crave answer. I'm say I'm on for with some question. Family of that, family, but most of our having. But I'm sure that now come once a man. I'm still in any day, so become. And if I was, or tackle my uncle in a
my uncle America.
My question is, to say that, even when it comes to red meat, red meat pie, because my teaching stories be and eggs in the cry. It is me and especially come and start watching the diet very carefully. But me training alright, me come and gym, me stomach ups, but still, me feel say me stomach muscle. Me the men saka me skin na me who say I say me wo excess fat me or surface. Is it because say me metabolism slow down? See that mean to me and Ben is a fat now. Now I say, is there something else I can do?
Okay.
Everyone might me a fast track because say me plan say me fair no. I think say me the oats beer, blueberries, banana, no chicken banana. Me make sure say me di heavy. Not the aka nyina you show say na be avoid say intermittent small eating and unnecessary money. So I just want to know what a bit of my metabolism not come back. Then now make me a chemical fat component in the belly. That's
the meeting I can't find is your fat distribution sometimes a genetically predisposed. As no be as slim as I am, but they may have issues with lipid metabolism. So maybe you are doing everything that you need to do. If you could have a clinic crowd, check your lipid panel and which is your cholesterol. If you are fine based on those results, and it looks like you shouldn't worry about anything. But you can still see CBR adipose fat somewhere that you don't want it to be. But you should be mindful that how you distribute fat around your body, it's also tied directly to your genetics. So it's not all the time that is metabolic syndrome, but it's just purely genetics. As long as you are doing what you're supposed to do with the diet and exercising, and you're seeing your clinician every now and then, making sure you are okay. The rest, you can try other modalities, pull-ups and things like that to help reduce it. But be mindful that fat distribution could also be genetics as well.
When it comes to exercise, see 5 days in a row, Monday to Friday, from let's say 10 p.m. to 10 p.m. to 12 in the night. Me exercise is sweaty heavy from Monday to Friday. Me no consistent. We me call Ghana 3 weeks. My exercise. No kwa me bam Sunday Monday massage start here. Me go back to my normal routine. See, sometimes when I felt maybe there's something wrong with my metabolism. Tina I mean to be benefiting quicker. Say me back in shape because all my other parts be a exercise be a tremendous results. Say me which me increasing my muscles which are but the low abdomen and quad me who change
Pape,
6 pack still.
and Sarah, doctors, I mean, just from a different point of view with regards to exercising. So, a full no year idea. Some muscle no very hard to tone it. What worked for me in the past, and I'm not even there yet, but in the past, what worked for me in the after COVID, because of now, close to gym near, now me work out, cry. It's after a while, who say, Nipenia or free the answer, so time of COVID, ne call ya be gyms, and call ya there, but ye be gyms near there. Me start to call back. No, what I did, I did a lot of cardio workouts, like a lot of running, even outdoor. Prior to so maybe a gym, me start to call outdoor running. Next man, and not helps. In addition to exercises now, and then the diets so over checking. So it's a work abdomen. At least I was say from my experience and from a normal literature on working your core. Also added like cardio workout at least once or twice a week, maybe at least twice a week. Also, to me, run about 1 to 2 miles, and sana, and before or after it could be either or before or after or cardio or abdominal workouts. 20 try no And then I'll leave the rest to Dr. Sebi Omonso, so other recommendations via medically, a bit so they are carried.
Razu, so with all these things, Mr. T, me call gym be most of the time. Mr. T with treadmill. Meet me around maybe about 30 minutes straight. And start weight lift. If you something that me like conscious on every time me try some rally sana.
Right.
My starting weightlifting. But I can see the weightlifting is working fine. But me lower abdomen no and corner me wire and cut you up quick as an internal. Well, you say, when it comes to carbohydrates, brown rice, I made now. Me said I need carbohydrates. White rice, may die. Me figure me bag there. I think say I did border control stop for me a brown rice. The kilo.
Right. Any offer. Checking the type of workout for your abdomen also. Because if say other muscles contract working, you're getting the results either say the exercises are be increase it, maybe a reps and also be try different exercises. When you work out in the gym at times be a plateau, and then I say be a weight now all corner. It drew maybe a muscle so no seem like it's not growing. That's a result be a bit and no either so be change your exercises now more intensive workouts and also be increasing weights. It be more increase weight, it be also increasing the number of reps and there or checking how well you are doing it. I know that should help. And then again, in addition, I defer to Dr. George and Pius almost also the more recommendations medically. And so
Okay. Amen. You may know for now. Personal training event today. We might present my next event. No, continue. Young personal trainer event in far way too much. Yeah, no separate. Hi, busy body. Who pay the Rasbo on what Bokama as a parenting.
And San 102.
That's the one. Kapesa doctors will never appear. Tabu eater.
Metam nasum. But me person me others like separates can is. We check numbers no. We check your labs right. Next look right or wrong and only find the most important thing for the cause disease than the physical look. Then when it comes to the physical, like what try to do, so you need to take a radical approach, right? So that's where you can like ubet me assistant from a nutritionist. Know what to keep maybe ketogenic diet, radical one, mostly green. No, not a beer a day or a beer a week. All sorts of herbs, agon, nafe, protein, greens, and fats, like good fats. Who take it that radical approach for 6 months, no matter what, your belly is gonna slim down. It doesn't matter like how big you are or how big your belly is. Just take that radical approach and it's going to slim down and it's going to reflect in your whole body, like your mind, body, soul. Like just take that approach. And it's hard, but you telling yourself just even 3 months. 3 months of radical, 3 months of green vegetable, green organic from organic store like Whole Foods, right? Just do that one for 3-6 months. And no matter what, your belly is gonna come down.
You George. Wait, Bob, quick. The George can't know also. That has actually happened to me, honestly. Some of the kaya is here in New Jersey. We have more pictures to crumble. South Road, any hope you.
Hey,
already I took a radical approach. Oh, and it's a Tony homie, 102 homie, and me new beer, me call Jim giddy beer. It's just 3 months. I'm sticking to veggies. Charlie, real. Yeah, I'm a council judge there. So. Results
bro, I'm motivated here. I said, the beginning, I think it's from the side. So we house here. Now, movie, if there, but Pius man, I said, George, you the another or the baby sauce.
Yeah, maybe actually my time limits. Let me free up by 8 about 8.
Yeah, so
okay.
I think that means so I conclude here. So
okay. All right, then Pacho mama me empa one line na enu na. Pacho jumedi di that we na master. So mo buy. Na say kesi so come here present as prior George. So jama boama and the topic the etimi ati na the questions they win na ma answer my is going forward the boy na. But more feedback here for this particular event. Executives will be sending messages direct by the bedroom. Now, Abuama, the future events that they know. It will be the sign to knock on our boy and say, the winner must. And the wedding coming on Yamia Duma, the story a Kaimo, Sunday, you meet Sunday, but another wire.
Wait, Sunday, unique meeting.
Because of events, I'm
it's next month, last Sunday, yeah.
I'm and we just say we are here to discuss and quite from that. But any meetings in a strong more boy for next month. And I meeting not the full month and Yasaya another event. Yeah, the winner master, I think could be
Thank you for watching the Health Talk webinar, and let's have your questions and comments below, and watch out for our next webinar soon. Thank you.